Thank you very much, Ricky. Next is our Pqi Clinical Overview. Todd Murphy will be providing an update on the Venetoclax Dispensing Pqi. Todd.
Hey everyone. We decided to develop the Pqi for Venetoclax Dispensing just because, and you can go ahead and advance the next slide. I think we have a little bit of a description and background here. So as you guys know, Venetoclax is indicated right now for patients who've received at least one prior line of therapy and patients diagnosed with CLL and deletion 17p. So there's a huge risk of TLS, well, not a huge risk, but there's a risk of TLS with this drug in these patients that we saw in clinical trials. So there's a ramp-up phase, as you guys know, with the starter pack, and there's a lot of different factors that go along with dispensing this drug, especially for the first time. So we decided to develop a Pqi off of a policy that we've been using at CCI since the drug was launched, and the first thing that needs to be done is a Tls Risk Assessment needs to be performed on every patient receiving this drug. So something that we do here in our clinic is we have developed a regimen in our EMR, and so every patient that gets prescribed this for CLL, we're going to drop that CLL regimen in, and basically it flags the physician to go ahead and do that Tls Risk Assessment. And it also has all of the pertinent labs dropped in as well with the schedule there. So you can see that, you know, the Pqi process is basically all around dispensing. So go ahead and advance the slide, and we'll take a look. Go ahead and go one more, and then we'll go back to that one more. So you can see that one of the addendums here to the Pqi is the risk assessment, and then also the ramp-up dose, and how do we assess these patients for inpatient versus outpatient starting. So you do have this as a quick reference within the Pqi. It's a little bit longer than the Pqi's that we've developed in the past. We try to keep these to 1 to 2 pages, but this one we thought was necessary to have this here so you didn't have to look it up online. So go ahead and go back 2 slides, and we'll kind of backtrack and go through this. So the process basically is an outpatient versus an inpatient start. And so what we decided to do is we decided in our cycle 1, day 1 was going to start between Tuesday and Thursday because we have to get pre-dose labs and then post-dose labs. So we make sure that every patient is getting this starting this on day 1 between Tuesday and Thursday. That way they can come back into the clinic on a Monday through Friday for their pre-dose and post-dose labs. We also make sure that they take every dose at 9 a.m. That way they can take their 6-hour follow-up lab at 3 before the clinic closes, and it kind of gives you some wiggle room there in case there's traffic or something like that that delays the patient getting to the lab. So go ahead and go advance 1 slide there. So then we also have an allowance for, you know, if we ship the prescription to the patient, and it's basically the same process as starting outpatient, making sure that they start between Tuesday and Thursday, and you know, we're going to make sure that we educate the patient because you know, obviously if we're shipping the prescription out to the patient, we don't have that face-to-face interaction, so we want to make sure that we're educating the patient in detail about the importance of keeping their lab dates. Now inpatient, obviously if the patient is starting inpatient, it's going to be a little bit easier to coordinate the lab and hydration schedule for the patients. But we do want to make sure that we educate them on the importance of making sure that they do go to the hospital and get admitted for the appropriate days with each ramp-up phase. Making sure that they do start their allopurinol on the proper date unless they're receiving Elotec. And then, you know, go ahead and go over the admittance and start date with them, and making sure that they understand the ramp-up phase. Which, you know, Venetoclax has got to really, AbbVie really thought out the packaging pretty well with the ramp-up phase, where you can't get to the next week until you actually physically take the first week out of the box. So it's pretty easy for the patient to understand there. But, you know, one thing that we always do, and that's included in the PQI, is to make sure that we do have the calendar there for the patient, which AbbVie also provided that in patient education material. So I encourage you guys to try to check that out if you can use branded education material for patients starting out.
Sorry to interrupt. Is that on the NCODA website? Is that PQI process on there?
Yeah, Jonas, I think have we already loaded that up there?
I'm not 100% sure, Todd. I think it might be up there, but I haven't looked.
I think it's been launched on the website. Yes.
Okay, I'll just keep checking. That would be really helpful to us here in Arizona.
Great. Go ahead and I think that was the. Go ahead and advance to the little appendix, and I think that's it. Yeah. Anybody else have any questions about it?
Hey, Todd, what EMR are you using that you've loaded this all in with?
We use Onco.
Oh, all right. Okay. Did you create any activities or anything to help with this, or is this all in your pharmacy system?
Yes. Yeah, we definitely created a really in-depth regimen for this. We've got regimens for all of our oral drugs, even the all-oral regimens. We've got regimens built in Onco with labs, and you know, follow-up visits, making sure that the patient everything is basically loaded in. So we would definitely encourage our physicians to use regimens, even if it is just an oral regimen.
Cool. Would it be possible for you to, you know, post a screenshot of how you have that regimen set up in Onco? I would love to see it, you know, because we're in the process right now of building all those oral regimens inside of Onco. We've only had Onco for about 6 months now, so, you know, any assistance or insight would be very helpful.
Yeah, sure. I can take a screenshot of that and send it over to you.
Awesome. Thank you.
Yeah.
Great. Thank you, Todd. One quick point before we move on. If your mic is not muted, please go ahead and mute your mic if you are not talking or asking a question. And for those of you joining by phone, if you are, please do not mute the line. Sometimes we hear some feedback as well. So thank you.